Let's discuss the Chinese medical theory, Chinese versus Western medicine, part 2. The integration of Chinese and Western medicine began in earnest following Mao's lead. By the 1960s, colleagues of Chinese medicine had been established and teams of scholars wrote textbooks in modern Chinese language, systematically laying out the principles of Chinese medicine for the training of a new generation of Chinese doctors. These textbooks followed the style of Western medical books, each volume covering a specific area such as basic medical theory, pharmacology, diagnostic techniques, internal medicine, pediatrics, gynecology, skin disorders, and acupuncture. This method of studying medicine through standard text was in contrast to the old way of learning from ancient medical classics, studying recorded cases of famous or legendary physicians and sitting as apprentices at the feet of experienced practitioners. As medical colleagues grew and expanded, postgraduate degrees and extensive research programs were introduced. Okay, today dozens of Chinese medical universities and colleges turned out large numbers of doctoral dissertations and publications by Chinese as well as international research students from Japan, Korea, Singapore, Australia, Europe, and the US. The modernization of Chinese medicine resulted in a systematization of Chinese medical theory not to be found in the classics, as well as additions to the theory that implicitly incorporated Western notions like viruses and bacteria, which is termed toxins, and borrowed concepts like the immune system and essential vitamins and minerals. The result of these sweeping changes was the birth of the traditional Chinese medicine, the modern form of Chinese medicine. TCM was traditionally only in the sense that it kept intact the main core of ancient Chinese medical theory. In the rest of this book, we use the term TCM theory to refer to the modern systematized form of Chinese medical theory. TCM attracted attention in the West following President Richard Nixon's historic visit to China in 1972. Western doctors saw Chinese medicine at work and witnessed the use of acupuncture to treat pain as a form of anesthesia. This aroused interest in TCM as a system of alternative or complementary medicine. In recent years, rising rates of serious illness like heart disease, stroke, cancer, and diabetes, even as Western medicine made spectacular advances in knowledge and technology, may also have influenced patients to seek alternative methods of healthcare. 60 years after Mao's edict for Chinese and Western medicine to work together, the ideological differences between them have largely remained unresolved. Integration of TCM and Western medicine has taken place only to the limited extent that TCM physicians are sufficiently trained in Western medicine to use both systems of medicine in their clinical work, while Western trained doctors take short courses to expose them to the basics of TCM. For the TCM physician, diagnosis by TCM methods is supplemented by laboratory tests and modern diagnostic procedures like blood tests, X-ray, MRI, PET scans. The treatment administered could be a combination of Chinese herbs, acupuncture, and selected Western pharmaceuticals such as antibiotics, steroids, and anti-inflammatory drugs. These physicians think in TCM terms when they diagnose the imbalances underlying an illness and decide the therapies to be administered accordingly. They would be prepared to and often do supplement TCM treatment with Western drugs to address more urgent conditions, including antibiotics for bacterial infections and steroids for acute inflammations. The term imbalance is used here in the generic sense of abnormality or deviation from the healthy state of the body. The kind of imbalance in particular pathological conditions is more precisely defined by TCM as deficiencies in yin and yang, and or the presence of pathological conditions like heat, cold, dampness, phlegm, and blood stasis. These terms are used in TCM in a different way from ordinary medical language and will be explained in subsequent chapters. Thank you for your attention.
Let's continue discussing the interviewing techniques. Tact and respect are needed when you are inquiring into areas that may be sensitive or private. Some people may find it embarrassing to talk about certain aspects of the body. For example, a 15-year-old girl may not be completely comfortable talking to a 50-year-old man about her vaginal discharge. For others, it could be certain emotional aspects that they are sensitive about. It is therefore important that we win the client's trust in us as therapists and help them to understand why our questions are relevant. It's also a good idea to rephrase questions so the person can relate to them or comprehend them. It is important to remember that the patient is not trained in Chinese medicine. It is, for example, unlikely that they will know what plumstone qi is. This can, of course, easily be rephrased to asking them whether they have a sensation that there is a lump in the throat, as if there is something that they cannot swallow. Other questions that are ostensibly straightforward should sometimes be reformulated, such as asking them whether they have a sensation of heat in the evening. The difference in temperature may be too subtle for them to register it as a sensation of heat or fever. But if you ask them whether they remove their jersey or are less sensitive to cold in the evening, they may answer yes. There are various strategies that can be employed when interviewing the client. It is definitely important to gather as much information as possible that is relevant to the diagnosis. However, Bob Floss believes that you should be systematic and only ask questions that are relevant to the imbalance patterns that may be manifesting in the specific disorder that the patient has sought help for. His view is that you should only investigate the patterns of imbalance that are relevant in the treatment of this disorder. His strategy is to look for confirmation or rejection of the patterns of imbalance that manifest in this disorder. Once you have received enough information to confirm or reject a pattern, you do not have to investigate further. He believes it is a sign of sloppiness when you ask haphazard questions and lack focus. The second strategy is to investigate all the available avenues. In this way, it is possible to identify patterns of imbalance that may not initially seem relevant, but are subsequently found to be significant in relation to the disorder that the patient presents with. The information obtained can also reveal symptoms and imbalances that the patient has not sought treatment for, but they may well be more important to address in the treatment. They may, for example, have sought treatment for allergic rhinitis, but through the diagnostic investigation, we discover that they suffer from insomnia, stress, palpitations, and cardiac pain. In these situations, you must make the patient aware that Chinese medicine can treat these disorders or the imbalance. They may well decide that they still only want treatment of their rhinitis, but now they can make a conscious choice. The two approaches are, of course, not mutually exclusive. In both scenarios, it is important to follow a thread when interviewing a person and not just ask them random questions. You should thoroughly investigate a certain topic before moving on to another area of questioning. The more information that you can gather from a patient and the more detailed the picture you can paint, the more accurate the diagnosis will be. In both strategies, it is important that you do not just leap to the next question when a patient has given you an answer. You must ask yourself whether the response generates a new question or whether the answer needs elaboration or more specific details. For example, if when asking about their bowel movements, they respond that they have loose stools, you need to find out what the consistency of the stools are, whether the stools are watery, containing undigested food particles, whether the stools are sticky, whether the stools have a strong odor, whether there is a burning sensation in the anus during or after defecation, whether there is pain or if they feel bloated in the abdomen before they have bowel movements, whether the stools and their movements are influenced by certain foods or stress, and so on. Interrogating the client is an integral part of the consultation and treatment. We must, though, be conscious from the outset and during the interview of precisely what information we're trying to gain. We must also be aware of how much time we have available to achieve these goals. If we have set aside an hour to diagnose and treat the client, we cannot sit talking to the client for 3/4 of an hour, as apart from treating the client. We must also receive payment and book a new appointment, and they must dress and undress. This means that we, not the client, must be the one who controls the structure and direction of the interview. Thank you for your attention.
Let's continue with the yin-yang theory and its application to medicine. Exterior to interior. The exterior of the body includes skin and muscles and pertains to yang. It has the function of protecting the body from exterior pathogenic factors. The interior of the body includes the internal organs, and it has the function of nourishing the body. Above to below waist. The area above the waist pertains to yang and is easily affected by yang pathogenic factors such as wind, where the area below the waist pertains to yin and is easily affected by yin pathogenic factors such as dampness. This basic general rule is frequently applied in the diagnosis of skin diseases. Posterior, lateral, and anterior medial surface of limbs. The yang channels flow on the posterior lateral surface of limbs and the yin channels on the anterior medial one. Yang and yin organs. Some organs pertain to yang and some to yin. The yang organs transform, digest, and excrete impure products of food and fluids. The yin organs store the pure essences resulting from the process of transformation carried out by the yang organs. The simple questions in chapter 11 says, the 5 yin organs store and do not excrete. The 6 yang organs transform and digest and do not store. Thus, the yang organs, in conformity with the correspondence of yang to activity, are constantly filling and emptying, transforming, separating, and excreting the products of food in order to produce qi. They are in contact with the exterior as most of the yang organs, such as the small intestines, the stomach, the bladder, communicate with the exterior by the mouth, anus, or urethra. The yin organs, on the contrary, do not transform, digest, or excrete, but store the pure essences extracted from food by the yang organs. In particular, they store the vital substances, that is, qi, blood, body fluids, and essence. Functions to structure of organs. Yang corresponds to function and yin corresponds to structure. We have just said that some organs are yang and some are yin. However, in accordance with the principle that nothing is totally yang or yin, each organ contains within itself a yang and a yin aspect. In particular, the structure of the organ itself and the blood, essence, or body fluids contained within it pertain to yin. They are its yin aspect. The functional activity of the organ represents its yang aspect. The two aspects are, of course, related and interdependent. For example, the spleen function of transforming and transporting the essences extracted from food represents its yang aspect. The qi extracted in this way from food is then transformed into blood, which, being yin, contributes to forming the structure of the spleen itself. The simple questions in chapter 5 says, Yang transformed qi, yin forms the structure. Here is an illustration showing the yin relation to function and structure, particularly in the spleen. Yang function of spleen transform and transport food qi, which goes to make blood, which is yin and represents the yin part of the spleen. Another good example of functional structure within an organ is that of the liver. The liver stores blood, and this represents its yin aspect and its structure. On the other hand, the liver controls the flow of qi in all parts of the body, and this represents its yang aspect and its function. Qi and blood. Qi is yang in relation to blood. Blood, which is a denser and more material form of qi, is therefore more yin. Qi has the role of warming, protecting, transforming, and raising, all typically yang functions. Blood has the role of nourishing and moistening, which are typically yin functions. Defensive qi to nutritive qi. Defensive qi is yang in relation to nutritive qi. Defensive qi circulates in the skin and muscles, which is a yang area, and has the function of protecting and warming the body, which is a yang function. Nutritive qi circulates in the internal organs, which is the yin area, and has the function of nourishing the body, which is a yin function. Thank you for your attention.
Let's discuss the extraordinary yang organs, the uterus, part 2. Relationship with the directing and the penetrating vessels. The uterus is closely related to the kidneys, the directing vessel, the renmai, and the penetrating vessel, chongmai. Both the directing and penetrating vessels originate from the kidneys and both flow through the uterus, regulating menstruation, conception, and pregnancy. In particular, the direct vessel provides qi and essence, and the penetrating vessel, blood, provides to the uterus. So we have here the illustration of the relationship between the uterus and directing and penetrating vessels. Normal menstruation and pregnancy depend on the state of the directing and penetrating vessels, which in turn depends on the state of the kidneys. If the kidney essence is abundant, the directing and penetrating vessels are strong, and the uterus is therefore adequately supplied with blood and essence so that there will be normal menstruation and pregnancy. If kidney essence is weak, the directing and penetrating vessels will be empty, and the uterus will be inadequately supplied with blood and essence, so that there may be irregular menstruation, amenorrhea, or infertility. Remember, the governing vessel also has an important influence on the uterus and menstruation, as it brings yang qi to the uterus, which is necessary for the ovulation. Although the directing and penetrating vessels are the ones that influence the uterus most directly, the influence of the governing vessel should not be underestimated. The menstrual cycle is like the ebb and flow of a tide of kidney yin and kidney yang, with yin increasing and therefore yang decreasing in the first half of the cycle, the follicular phase, and yang increasing and therefore yin decreasing in the second half of the cycle, the luteal phase. In terms of channels, this tide of yin and yang occurs in channels that flow through the uterus. That is the directing vessel bringing yin. The penetrating vessel also bring yin, but more specifically blood, and the governing vessel bringing yang. From this point of view, the governing vessel is as important in menstruation as the directing and penetrating vessel, as it brings yang qi from the kidney yang to the uterus in order to promote ovulation. Ovulation needs heat. So we have here the relationship between the uterus and the directing and penetrating vessels. As a summary, both directing and penetrating vessel flow through the uterus. The directing vessel brings qi, yin, and essence to the uterus. The penetrating vessel brings blood to the uterus. Thank you for your attention.
Let's continue with treatment principles, route, and manifestation. The principles of treatment can be discussed from 3 points of view: the root or pen and the manifestation, piao, when to tonify the upright qi or zheng qi, and when to eliminate pathogenic factors, the question of when to tonify and when to reduce. We shall discuss points 2 and 3 together as they are concerned with the same basic issue, so that the discussion will be under the following: the root and the manifestation. We treat the root only, treat both the root and the manifestation, treat the manifestation first and the root later, then the multiple roots and manifestations. Multiple roots, each giving rise to different manifestations, one root giving rise to different manifestations. The root coincides with the manifestation. When to tonify upright qi or zheng qi, when to expel pathogenic factors. Tonify upright qi, expel pathogenic factors. Tonify upright qi and expel pathogenic factors. First, tonify upright qi, then expel pathogenic factors. First, expel pathogenic factors, then tonify upright qi. Tonify upright qi and expel pathogenic factors simultaneously. The root is called pen in Chinese, which literally means root, and the manifestation is called piao, which literally means outward sign or manifestation. That is the outward manifestation of some inner unseen root. The root and manifestation can be compared to a tree, its root being the root and its branches the manifestation. So here is a very good illustration of the root and manifestation as a tree. Number 1, from the point of view of upright qi or zheng qi and pathogenic factors, the root is the upright qi and the manifestation is the pathogenic factors. Number 2, from the point of view of pathology, the root is the root of the disease and manifestation is the clinical manifestations. Example, invasion of external wind is the root and its clinical manifestations, the manifestation. 3, from the point of view of patterns, the original pattern is the root and the one originating from it is the manifestation. For example, spleen chi deficiency leading to dampness. 4, from the point of view of onset of the disease, the root is the initial condition while the manifestation is the later condition. 5, from the point of view of duration of the disease, the root is a chronic disease while the manifestation is an acute disease. Thus, when treatment of root or manifestation is discussed, we need to be clear about the particular standpoint or context being considered. For example, to say that in a certain case, the root needs to be treated first could mean that the upright qi needs to be treated first, or that the root or cause of the disease needs treating, or that the chronic condition should be treated first. In clinical practice, however, root and manifestation are usually considered in the second and third contexts, that is, as root and clinical manifestations of the disease and as original and deriving pattern. So, invasion of wind cold, the root, this will give rise to the manifestations: aversion to cold, fever, occipital stiffness, sneezing, floating tight pulse. Root and manifestations as original and deriving patterns. So, dampness as originating from spleen chi deficiency. 2 main meanings of root and manifestation. The root is the root of the condition, for example, wind cold, and the manifestation is the clinical manifestations: aversion to cold, fever, floating pulse, etc. The root of the condition is the original pattern, for example, spleen chi deficiency, and the manifestation is the deriving pattern, for example, dampness. Thank you for your attention.
Let's continue discussing lung imbalances as part of the diagnosis according to Zhang Fu organ patterns. lung imbalance patterns pathology. If exogenous qi invades the body, Wei qi is the first aspect or level to be attacked. Wei qi is controlled and spread by the lung. This means that when Wei qi is disturbed in its activity and movement, lung qi is also disturbed. This can lead to the lung not descending and spreading qi as it should. Lung qi will then accumulate and eventually become rebellious in ascent upwards. This rebellious lung qi can manifest as coughing and sneezing. The lung also spreads diarrhea throughout the body. When lung qi is impaired, it can no longer spread its fluids, which will then accumulate in the lung and form thin phlegm. When lung qi becomes rebellious, this will force the thin phlegm up to the nose, resulting in an exudation of thin, clear, watery mucus as a consequence. The stagnated fluids and thin phlegm will also be driven up to the face by the rebellious lung qi and can give a slight puffiness to the face. This puffiness is often apparent in the area around the eyes. The disturbance of the lung's ability to transform and spread fluids can be so extreme that, as well as there being edema and thin, watery sputum in the lung, there can be problems with urination because the lung is not sending fluids down to the urinary bladder. If heat is present in the lung because wind heat has invaded the lung, exogenous qi has penetrated down to the qi level or heat has been transmitted to the lung from another organ. The fluids in the lung can be condensed by the heat. This will result in the fluids becoming thicker and sticky. If the heat is mild, the phlegm will be viscous and white. If the heat is more intense, the phlegm will be yellowish or greenish. The heat can be so intense that it causes vessels in the lung to rupture. If this is the case, there will be blood in the sputum. Excess heat will also cause upward movement of the rebellious qi to be more powerful. This will mean that cough will be louder and barking. Heat can ascend to the nose, throat, and eyes and cause this to become red and irritated. When there are invasions of exogenous Wei qi will be blocked as described above. When qi stagnates, pain arises. In this situation, there will be aches and stiffness in the muscles and joints. Because Wei qi circulates in the Taiyang aspect and because wind tends to invade the upper parts of the body, the soreness and stiffness will be most pronounced in the neck and shoulders where the Taiyang channels traverse. The blockage of qi in the Taiyang channels can also result in there being a headache. As well as protecting the body against invasions of exogenous qi, Wei qi warms the skin. If Wei qi is blocked, especially by exogenous cold, Wei qi will not be able to warm the skin, even though there is sufficient heat in the body itself. This will manifest with the characteristic symptoms of a person freezing and not being able to get warm, even though they pack themselves into clothes and under blankets. This is in contrast to yang qi deficiency, where the person cannot generate enough warmth in the body and is very sensitive to the cold. But if they put on sufficient warm clothing, they will not feel cold. The inability to warm the skin when there are invasions of exogenous qi will manifest with a pronounced aversion to cold. This is most marked when there is wind cold and less so when there are invasions of wind heat. When wind qi is weak, as typically the case when a person is lung qi deficient, the person will be vulnerable to invasions of exogenous qi and wind. This will mean that they have an aversion to drafts in particular and to cold in general. They will also suffer from frequent colds and other respiratory disorders. The lung controls the pores in the skin by its relationship to Wei qi. the way qi is blocked by exogenous cold, it will not be able to open the pores. And it is actually through the pores that wave qi should expel the exogenous qi. This means that one of the key symptoms of invasion of wind cone is that the person does not sweat. Conversely, if there is lung qi deficiency, wei qi is thereby weak. The pores in the skin will not be controlled, and the person will sweat spontaneously or on light exertion. Invasions of exogenous qi takes place in the exterior aspect of the body. This is reflected in the pulse, which will be superficial. As an invasion of exogenous qi is an acute condition, there will not normally be major changes in the tongue presentation. The lung is very sensitive to dryness. This can be exogenous dryness or dryness that arises when there is yin deficiency. Dryness arises when there is yin deficiency because yin is an aspect of yin. If the lung becomes desiccated, its qi mechanism will become disrupted and lung qi will become rebellious. This will manifest with a dry, ticklish cough with no sputum or only small amounts of thick, rubbery sputum that is difficult to expectorate. When there is yin deficiency conditions, the cough will also be weak due to lack of qi. In this situation, the cough will be worse in the evening and at night or when the person speaks. Dryness will also be seen in the fact that skin can be dry. The voice will often be hoarse and the throat will feel dry. Excess heat coughs are explosive and loud. This is because there is an accumulation of qi in the lung and because heat has an ascending nature. This means that there is more powerful and more dynamic ascending movement of rebellious qi in the lung. At the same time, heat condenses yin in the lung, so it turns into phlegm. This will manifest as sputum that is usually thick, yellow or green, but it can also be white, thick, and viscous. The cough will usually be worse in the morning because phlegm will have accumulated and stagnated in the lung during the night. The phlegm will often be difficult to expectorate because the sputum is so thick and sticky, even though it is copious. A smoker's cough is a typical example of this type of cough. Both deficiency and excess heat can agitate blood so much that the vessels in the lung rupture, which produces bloody sputum. Damp phlegm or phlegm cold will also disrupt the qi mechanism in the lung and results in a cough. The sputum here will be thinner and more fluid. This type of sputum will be easy to expectorate. If the lung is blocked by phlegm fluids, which is a very watery form of phlegm, there will be very thin, watery sputum that is easily expectorated. There will also be wheezing. The sputum will be so thin that the person will find it difficult to lie flat on their back, as they will quickly feel suffocated. They will also vomit thin, frothy mucus when they cough. If the lung is too weak to send qi downwards, qi will eventually become rebellious and rise upwards. This will manifest with a weak cough because the deficiency of qi will mean that there is not much force behind it. The lung descends and spreads qi. If this qi mechanism is disrupted, the person will be breathless or they will have superficial, shallow respiration. They can also have a stuffy, distended, or oppressed sensation in the chest. There will, however, be differences in how and when these symptoms are experienced, depending upon whether it is a deficiency or excess condition. When there are deficiency conditions, the lung will lack the strength to be able to descend and spread qi. This will mean that the person quickly becomes breathless, even on light exertion. When there is lung qi or phlegm stagnation, they will also be breathless, but it will feel as there is something that is blocking their breathing. When qi stagnates in the chest, it can be hard to inhale fully, and it will feel as if there is a strap or an elastic band around the chest, making it difficult for them to inhale deeply. When there is phlegm stagnation, it will feel as if there is a heavy weight like a rock that is lying on top of the chest. They will therefore find it difficult to inhale deeply and get enough air into the chest. The voice is created by zhong qi, and is thereby affected by the state of the lung. If there is lung qi deficiency, the person's voice will be weak and they will often be disinclined to talk. This is not the same as when there is heart qi deficiency. When there is heart qi deficiency, the taciturnity is due to shyness rather than talking requiring an effort. Lung yin deficiency can cause the voice to be low or weak. The voice will also sound dry or hoarse when there is lung yin deficiency. When there is phlegm heat, the voice can be loud, but also gravelly or hoarse. Because the lung is fundamentally involved in the production of qi, a key symptom of lung qi deficiency is fatigue. There can also be a pale face because of the weakness of qi will result in less blood circulating in the skin of the face. When there are cold conditions, the face will be brighter white that is almost shiny rather than just lacking color as it does when there is lung qi deficiency. When there are heat conditions, the face can be red, either only on the cheekbones as seen when there is lung deficiency, or the entire face can be red and ruddy when there are excess heat conditions. Heat will also make the person thirsty because it consumes and endures fluids. There is a close relationship between the lung and its partner organ, the large intestine. This is seen in the process of defecation. The large intestine is dependent on the lung sending stool out of the body. If there is lung qi deficiency, the person will have difficulty defecating. They will feel exhausted and they will often sweat afterwards. They will often feel that the defecation was incomplete. The lung resonates with the emotions of sorrow and melancholy. These emotions will affect the lung qi. At the same time, if the lung is qi deficient, the person can also experience an underlying or pervasive sense of sorrow and melancholy. The general symptoms and signs of lung imbalance are as follows: cough, runny or blocked nose, shortness of breath, sweating disturbances, fatigue, and chest oppression. Thank you for your attention.
Let's continue with the diagnosis according to 8 principles. Overview Part 2. Diagnosis according to 8 principles. Using the 8 principles in practice requires flexibility. One must accept that there may be a contradiction within the same diagnosis. One must learn to understand the dynamics and relationship between the individual components. This means that it is then possible to accept contradictions such as heat and cold, deficient and excess. Interior and exterior are not just in the same patient, but also in the same disorder. It is important to perceive and comprehend the imbalance as dynamic processes of change. Imbalances create new situations that in final end can be the opposite of themselves. The following example considers spleen yang deficient. The spleen is in the interior, so this is an interior imbalances. Yang deficient is a deficient condition. Because it is a yang that is deficient, there will be a lack of physiological heat. Spleen yang deficient is therefore an interior yang deficient condition. Spleen yang deficient will often lead to the formation of damp. Dampness is a form of evil qi and is therefore something other and more than the body's sheng qi, so it is an excess condition. The dampness is an interior. This means that dampness is therefore defined as being an interior excess condition. Dampness is yin in nature, but on the other hand, it is neutral in its temperature. Dampness is therefore an interior yin excess condition, but is neither hot nor cold. Spleen yang deficient resulting in dampness is thereby a condition of interior yang deficient cold and interior yin excess at the same time. Patterns of imbalance are not static but are dynamic and mutable. It is a fundamental principle of the universe that yin and yang transform into each other. Therefore, one pattern can transform to another. Cold can transform to heat. Excess condition can injure the body and thereby create a deficient condition. Interior imbalances can become interior and so on. In the above example, the yang deficient condition easily have arisen after an invasion of interior excess cold, and resulting dampness could lead to the creation of damp heat. Even though a diagnosis will usually comprise multiple components, for example, interior yin deficient heat or interior excess cold, it is important to understand the dynamics of each separate aspect of the 8 principles. For the sake of clarity, it is therefore necessary for the following sections to discuss its aspects separately. These individual aspects are, though inextricably integrated with each other, and various combination of these 8 components will each have their own unique manifestations. There are, for example, significant differences not only in the symptoms and signs of cold and heat, but also in the symptoms and signs that manifest when there is deficient heat and excess heat, or when there is an interior heat and exterior heat, as differences between interior excess heat and exterior excess heat, interior deficient heat and interior excess heat, and so on. It is important to have this in mind when you read the following sections. Interior and exterior imbalances. The differentiation here is between where in the body the imbalance is located, not what it is that has created the imbalance. The invasion of wind cold is an interior imbalance, not because it is exogenous evil qi that has created the imbalance, but because the imbalance is manifesting in the body's exterior aspect, more specifically in the wei qi aspect. This means that even if the imbalance is caused by the presence of an exterior pathogen, it is exogenous evil qi is located in the interior aspect of the body. It is by definition an interior pattern, as well as identifying in which aspect of the body an imbalance is located. Interior and exterior will often give an indication of how serious an imbalance is. Exterior imbalances are usually less serious than interior imbalances, because it is the sangpo organs and the vital substance that is affected when there is an interior imbalance. Thank you for your attention.
Let's discuss the Western differential diagnosis for cough. Both acupuncture and Chinese herbs give excellent results in the treatment of cough. Obviously, acute cough, whether external or internal, is easier and quicker to treat. Coughs from acute respiratory infections can be cleared in a few days at the defensive qi or qi level, and it is not necessary to take antibiotics, which often only lead to residual heat or phlegm heat. Chronic coughs are also relatively easy to treat. The most difficult one is that from lung insufficiency, which may take some months to clear. Of all the patterns appearing with a chronic cough, Chinese herbs give better results in the patterns of dump phlegm, phlegm heat, phlegm fluids, and lung insufficiency. From the point of view of Western medicine, it is important to consider that coughing is seen in most pulmonary diseases and can occur with other signs and symptoms, varying widely and depending on its etiology. For example, it may be accompanied by fever and sputum in case of infection, whereas dry cough or hemoptysis can be a sign of lung cancer. An acute cough lasts less than 3 weeks, and clinical experience suggests that the most common causes are upper respiratory tract infections. A chronic cough lasts more than 8 weeks, and if the chest x-ray is normal, it may be caused by adverse effects of ACE inhibitors, gastroesophageal reflux disease, post-nasal drip syndrome, conditions of the nose and sinuses, and asthma. The following are the main causes of cough from the perspective of Western medicine. Tracheitis usually occurs following an invasion of wind heat, upper respiratory infection. The cough is harsh and painful, and the throat and trachea feel very raw and sore. It is usually worse at night. From a Chinese perspective, this broadly corresponds to lung dryness following invasion of wind heat. Acute bronchitis usually follows an upper respiratory infection, and the cough is loose with expectoration of yellow, green, or purulent sputum. Temperature and pulse are raised. From the point of view of Chinese medicine, this broadly corresponds to the Qi level with phlegm heat in the lungs. Chronic bronchitis is more frequent in smokers over 40. The cough is productive of white, yellow, or blood-flecked sputum. From a Chinese perspective, this corresponds to either damp phlegm or phlegm heat in the lungs on a background of spleen deficiency. Whooping cough that occurs in children, mostly under 5. It starts like an ordinary cold with a cough. After a week, the characteristic whoop appears. The cough comes in bouts that are worse at night and are very distressing. The coughing bouts often end in vomiting. The child is flushed or cyanosed and looks frightened. Chinese medicine can alleviate the symptoms and shorten the course of this disease, but it requires very many treatments given every day. In the beginning stage, it corresponds to invasion of wind heat. In the middle stage, to lung heat, and in the recovery stage, to stomach and lung deficiency, possibly with some residual heat. Pleurisy consists of inflammation of the pleura, usually occurring after an upper respiratory infection. The cough is unproductive and distressingly painful. There is also chest pain and the temperature is raised. From the point of view of Chinese medicine, it corresponds to lung phlegm heat at the Qi level. Pneumonia consists of an infection of the lung alveoli. It may begin abruptly with shivering, a headache, a high temperature, and breathlessness. Cough is short and unproductive at first. It then develops scanty sputum, which is viscid, rust-colored, and blood-flecked. Pneumonia is nearly always accompanied by pleurisy, which causes chest pain. Temperature is high, patient is flushed, pulse and breathing rapid. There may also be movement in the ala nasi. From the Chinese point of view, it corresponds to lung heat at the Qi level. Carcinoma of the bronchi is the most common cancer of all. This occurs most often in men between 40 and 55. It is characterized by a dry cough, breathlessness, and a deep-seated thoracic pain. There may be some scanty blood-flecked sputum. Patient is weak and debilitated and lacks appetite. From the Chinese point of view, it corresponds in its late stage to lung yin deficiency. TB, or tuberculosis of the lungs, is an uncommon disease in the States. It is on the increase in both the UK. It is very common in the Philippines. It is more frequent between the ages of 15 and 45. Cough is dry or with a scanty blood-flecked sputum. There is also chest pain, breathlessness, and night sweating. Patient is very tired and debilitated and may have a low-grade fever in the afternoons. From the Chinese point of view, this condition is typical of lung yin deficiency with anti-heat. Bronchiectasis consists of permanent dilatation of bronchi and or bronchioles. The alveoli become distended and filled with mucus. The cough occurs more in the mornings and is productive of large amounts of sputum, which is purulent and has a fruity odor. Breath is offensive after a bout of coughing. During acute episodes, there is a temperature. From the point of view of Chinese medicine, it may broadly correspond to the pattern of turbid phlegm in the lungs in breathlessness. People with heart failure may experience cough, which can result from fluid congestion in the lungs. Typical signs are orthopnea, sensation of breathlessness in the recumbent position, relieved by sitting or standing, and paroxysmal nocturnal dyspnea, sensation of shortness of breath that awakens the patient often after 1 or 2 hours of sleep and is usually relieved by the upright position. Blood in the sputum requires careful examination. Treatment of cough with bloody sputum must always be preceded by a correct diagnosis based on Western medicine. Thank you very much for your attention.